Hey everybody. Hi. It's a little weird to not have your faces staring back at me. I really am here in the void. But yes, this is the Ren and Du lecture, and then I'll do the final exam review. I'm going to keep referring to me as we because I'm used to you all being here with me. I'm just going to pretend like you're here with me. So first things first, let's look at this PowerPoint. Gonna screen share. All right. There's my funny cat's face. Boop. Okay. So Ren and Du, like I said earlier, we are going to blast through this very quickly. So we'll start with the Ren. So Ren channel physiology and pathology. We know that we have 6 front move points on the Ren channel, so a lot of heavy hitters there. We know that our Ren is our C of yin. The yin channels converge at the Ren, which governs the uterus. As far as pathologies go, we're usually looking at lower jiao stuff, lower abdomen, related to spleen, liver, and kidney, our 3 yin organs. Very often we're using the Ren channel to treat disorders having to do with gynecology, as well as things like impotence, also urinary issues and Shan disorder. We can also treat pathological changes elsewhere, as far up as the chest, the lung, the trachea, the esophagus, all the way up to the teeth and the lips. So remember that we do have the Ren channel going up all the way to the face. Ren 3, first Ren point we're going to talk about, Ren 3 being the front move of the UB. It says here in the notes it's a good place to palpate for UB issues. So we can think of it as like an Osher point, if you will. We're going to be using this for UB patterns, essentially. Very often damp heat in the urinary bladder, issues with stagnation of water, things along those lines. Also for reproductive system disorders, particularly cold, pathogenic water and pathogenic dampness in the reproductive system for both males and females. And then, like I said, local disease patterns, so anything having to do with the lower jiao. This is going to be an important point. Differentiation of point functions, I want to mention Ren 3 versus Ren 9. They're both used for issues with the water passages, but Ren 3 is more specific to the urinary bladder, really does help with urinary issues, whereas Ren 9 is more widely applicable, anything having to do with impairment of movement of water and damp. And also works more on the more on the middle jiao because of its location. It's above the umbilicus, so having a stronger action on the middle jiao. I do want to just highlight real quick the fact that we can use cooling method or warming methods on this point, depending on whether we've got heat or cold in the body. So it is a versatile point depending on the technique that you're using on it. A couple more side-by-side comparisons here. Ren 3 UB28, UB28 of course being the back shoe of the UB. Ren 3 more effective with patterns relating to failure of UB retaining function, impairment of qi transformation of UB in damp heat as opposed to UB28. Ren 3 is generally quicker with results. Typically, if we have UB issues, quite frankly, we're going for Ren 3 over UB28. We do know that we can use both, of course, but really in practice, I find for myself, I use Ren 3 far more often than I use UB28. And then Ren 3 versus Ren 4 versus UB23 versus spleen 9, they do all promote urination. We're basically looking at spleen points and kidney points here. So they both have to do with promoting urination. They just do it differently. Ren 3, again, qi transformation, opening water passages, generally used for lower jiao. Ren 4 is more specifically about supplementing yang. So it treats urinary issues when we have yang deficiency. And then UB23 is really about kidney qi issues. So that's when we would use that. And then spleen 9 is going to be when we have issues with the spleen organ itself leading to dampness and issues with water passages. So just depends on what pattern you're trying to treat here. You might use a combination of some of them. Very often we will use Ren 3 in addition to any of those other points, because Ren 3 can be used more as a branch point as opposed to a root point, whereas things like Ren 4, UB23, spleen 9 really are more so root points. Point combinations. So here we go, Ren 3, spleen 9. That's really going to help transform water in the middle jiao and the lower jiao. And we can get the urine moving properly. Ren 3 with Ren 9 combination. We'll often combine that with moxa to warm the yang. And again, that's a middle jiao, lower jiao transformation. And then Ren 3 with UB28, front move back shu. That's going to be nice. We can reinforce to restrain the UB, move water, and then reduce to actually open the water passages. So we can either crank up the urination or crank down, depending on our needle technique on that one. Some more point combinations here. Like I said, Ren 3, Ren 4, UB23, all combined. Definitely going to be looking at the kidney with that, moving water with Ren 8, Ren 9, moxa at Ren 8, Ren 9, Ren 4. That's going to help. It's going to help boost spleen yang and really get the dampness and the water moving. And if we combine with GB34 and spleen 9, we're looking more at damp heat, gallbladder involvement there. And then we can do Ren 3 with Heart 5 to clear heart fire and promote urination in the case of Lin syndrome. Heat Lin, I should say. Let's see, next up we can add moxa with spleen 9. That's basically just going to help boost that warming of the yang and help qi transformation. And then a couple of reinforcing point combinations here with Ren 4 and spleen 9. That's going to help supplement the spleen yang. And then with UB23, that's going to help supplement the kidney and restrain the urinary bladder. So we can see here with most of these point combinations that we're looking at with Ren 3. Ren 3 is being used as a branch point. It's being added onto root treatments. Next up is Ren 4, another important point, front move of the small intestine, used for disorders of both the middle jiao and the lower jiao, used for lower abdomen disorders, genitourinary system disorders. It is a key point, it even says here in the note, key point for strengthening yang. This is an important yang strengthening point. You can even, yeah, you can definitely see Ren 4 added on to a lot of point combinations when you are trying to nourish the yang, to tonify the yang. Of course, when we're talking about yang, we're looking at specifically the kidney. So definitely disease patterns of kidney yang deficiency. We know that we can have some involvement with the spleen with that, maybe urinary bladder, maybe the spleen stomach. We can use it for all of those things. So differentiation of point functions here, Ren 4 versus Ren 8. We know they're both yang warming points. Ren 4 more often than not used for kidney yang and lower jiao issues, whereas Ren 8 is more for middle jiao, so spleen, stomach, yang deficiency. But both points can assist in boosting the other jiao. So very often, if we are actually trying to have an effect on the yang, we'll use both of these points. We remember that Ren 8, of course, is moxa. So point combinations, naturally we're going to see some kidney points with Ren 4 for some things. So Ren 4 with kidney 3, UB23, that's really going to help warm and supplement kidney yang, as well as nourishing essence and blood. We've got with kidney 7 and UB23, tonify kidney yang, tonify the yin to tonify the yang. That's always a smart application. And then some more down here with stomach 29 and spleen 6, that's going to move blood and dissipate clumps, specifically in the local area in the lower jowl there. That's what that's referring to. You can also add moxa to that if there is cold. And then the last one here on this slide with stomach 28 and reducing spleen 6, that's going to help warm, cold, move damp, free the channels, and move blood. So another case of stasis. Then we have Ren 6. Ren 6 is our C of Qi point. That's Qi high, right? Gathering point of source Qi. This is a very important point. It's going to be used to treat disease patterns of insufficiency of Yuan Qi, source Qi, generated for Jing Qi. This is going to help promote functional activities of all organs and all tissues. And then this is also a point that is used to treat blood patterns related to Qi and blood. So stasis, blood cannot be contained due to Qi deficiency. So the Qi and blood relationship there being touched on with Ren 6. You can definitely reinforce or reduce with this point more often than not. We are going to be reinforcing, but we will be using the reducing method in order to dissipate stasis in the case of Qi and or blood stasis. All right, next slide, differentiation of point functions. We've got Ren 6, Ren 4, Ren 3, spleen 9. These are basically touching on different substances here. So Ren 6 is about Qi. Ren 4 is about yang. Ren 3 is about water, and spleen 9 is about damp. So they can all be used to treat very similar sets of signs and symptoms, but they are going to be treating distinctly different patterns. But of course, we know in real life, we will probably be combining some of these points because it's very rare that someone only has issues with Qi or only has issues with yang. More often than not in the real world, we know that people have mixed patterns. Ren 6 point combinations with kidney 3 and kidney 7. That's going to help with kidney Qi. With Ren 4 and heart 7, that's going to help restore the pulse, warm the yang, boost the Qi. So that's to be used in the case of collapse, yang collapse. With Ren 4, Li4, and stomach 36, that's going to help boost Qi, return yang, and stem desertion. So both of those two are very strong point combinations. And then moving down here, reducing method with spleen 6, that's going to help move and invigorate the blood. You can also add liver 3 in there to move liver Qi. And then with Ren 3, that's going to help move Qi and specifically move water. In addition to that, you can mox the Ren 3, add stomach 29, spleen 6 to help move the blood in addition to moving the Qi and the water. And then we've got Ren 8. Ren 8 is Spirit Watchtower, considered the foundation of life for the fetus and closely related to Zang organs. This is the belly button, right? The umbilicus. Key point for warming and returning yang and stemming counterflow cold. So we talked about it just a couple minutes ago. This is a really, really important point for warming yang. So disease patterns of yang deficiency and deficiency cold, that's mainly what we're going to be using this for. We can also use it for disorders of channel sinews, so treating issues with hypertonicity or flaccidity of the lower abdomen and or the umbilicus. So pretty much anywhere in the abdominal region, not so much epigastric, but abdominal area, we can use Ren 8. Mentioned it a minute ago, but bears repeating, we're never going to needle Ren 8, right? We are doing moxa here. You can do moxa roll on ginger, salt, or aconite if you want to rouse yang in the middle jowl, supplement the kidney, return yang and stem desertion. Hi. And this is going to be, we can moxa for 10 to 30 minutes for cold lumps and also blood stasis. All right, so this differentiation of point functions here is just a reiteration of what it was saying before. Ren 4 better for lower jiao, Ren 8 better for middle jiao, but you can use both to help either. And again, in real life, we're probably going to be combining these points. All right, so application of moxibustion, which is the only application we have for this point. Point combinations with Li4 stomach 36. We can even add Ren 4 in there. That is really going to boost yang and qi. If we add in stomach 36 and moxa at stomach 25, that's going to really help supplement deficiency, warm the middle jiao, astringe the intestines, and stem desertion. So we use that in the case of yang deficiency diarrhea. And then with reducing at spleen 4 and Ren 12 and Ren 13, that's a really great combo for cold in the stomach causing counterflow. And then with UB20 and 21 to just really help warm and supplement the middle jiao. Next up is Ren 10. Ren 10 treats disorders of stomach and intestines. Reducing method is usually applied at this point. So we are talking about intestinal disorders. Disease patterns caused by dysfunction of stomach and intestines. This can be a root point to help generate qi and blood. Hey, she's chewing cords now. She does not like it when I teach, sorry. Stop that. All right, so yes, this can be used as a root point to help with the stomach. But it can also be a branch point, kind of a, you could think of it almost as a local point, considering where it is. And then we can use it for local disorders of the channel. So even can be used for cold Shan disorder or masses, depending on location. Like I said, reducing method is really what we're going to be using on Ren 10. You can add cooling method to clear heat. You can add moxa to warm and dispel cold. This is an important differentiation of point functions. Ren 10 versus 12 versus 13. Ren 10 influences the lowest part of the stomach. It is going to be good at helping to free the intestines. Ren 12, couple soon up, middle influences the middle part of the stomach. It's really good at harmonizing and regulating qi in the middle jiao. And then we have Ren 13, which treats the upper part of the stomach, and that is more effective at bearing counterflow qi downward. It also does have an effect on the chest and the diaphragm because of its proximity to the upper jiao. So you can think of these basically location-wise. That's how you can discern the functions. Ren 10 is a little bit further down, 12 in the middle, 13 being the highest. All right, so point combinations, we can see Ren 10 combined with stomach 25 a few different times. We know that stomach 25 being the front move of the large intestine, it's going to have an action on the intestines, so we can guess where those point combos are going to go just from there. First one we've got with Ren 3 and stomach 37. That is going to help get rid of damp in the intestines, stop diarrhea. Add in stomach 36 for food stagnation. Add in spleen 6 for blood stasis, as well as qi stasis. And then we can throw some moxa on with stomach 21 and Ren 8. That's going to dispel cold. With spleen 4 and Ren 6, moxa only on Ren 8, that is going to warm the yang. It's also going to bear counterflow qi downward and stop pain. Next up is Ren 12. Got to talk about Ren 12. Talking about heavy hitters. That is the front mu of the stomach, also the Hui meeting point of Fu organs. So really that's what we're going to be looking at here as far as what it treats. You can see here on the slide it says palpate Ren 12. We know that our front mu points can be used as diagnostic points. So this is definitely one of those where you do want to palpate this point. It will tell you whether or not it needs a needle more often than So in addition to treating disorders of the stomach, we're going to be treating disorders to the stomach that also relate to other organs. We know that stomach often has involvement with other organs as far as pathology is concerned: the spleen, the liver, the heart, the lung, gallbladder, the large intestine, the small intestine. It reaches out in different ways to affect different organs. So this point is going to have a wide variety of applications for various patterns. Disorders of food organs. So really the intestines, the stomach, the gallbladder, and the pancreas. We can use Ren12 as well. We can use it for deficiency patterns related to the stomach, despite the fact that it is a front mood point, which we often think of more for excess. This is absolutely one of those where we can use it for deficiency. It's a very common point for regulating the stomach. We will also use this for phlegm disorders that are affecting the stomach specifically, and then of course local disorders, so any sort of pain or masses that are local to that Ren12 area. We may reinforce, we may reduce. We can also add moxa to this point. We may even use cooling method on Ren12 if it is necessary. Okay, differentiation here, Ren12, Ren22. We talked a little bit about this earlier in our half of the term. We know that they both dispel phlegm. I think this is when we were talking about stomach 40. Stomach 40, Ren12, Ren22, all dispelling phlegm. But Ren12 warms and transforms cold phlegm to dispel it from the stomach, while Ren22 opens up phlegm, benefits the movement of qi to dispel phlegm from the lungs. Ren12 can also be used for heat as well, but really the differentiation that we're looking at here is middle jiao versus upper jiao. Ren22 often used specifically when there is phlegm affecting the throat. All right, Ren12 stomach 36, UB21. Ren12 is most effective and quickest to get rid of food stagnation and cold. That is what it is, yeah, the most effective at. You can also add moxa. And then with, let's see, Ren12 and stomach 36, you are often going to be combining these. This is a very, very, very common thing where Ren12, stomach 36, and UB21 in real life, they're going to be used together. So you can reduce or reinforce with those two, depending on what you're trying to do, whether you're trying to guide out food stagnation or bear counterflow qi downward. You're going to be reducing. If you've got deficiency, you're going to be reinforcing. You can also add in addition to that combination of Ren12, stomach 36, prick to bleed Sefeng. That is very good at dispersing food accumulation. Any type of food stag can be treated with this combination. That's definitely one to keep in your memory. You can add in reducing PC6 for vomiting, reducing spleen 4 for hiccups. And then if you have constipation, you take out Sefeng and reduce stomach 25 instead. It's a great point combination. I've used that a few times. And then reducing method with PC6 and spleen 4, that's going to bear counterflow qi downward for vomiting or hiccups. And then with Heart 7's PC5, that's going to be great for moving qi, transforming phlegm, and arousing the mind. Okay. We can add moxa in with Ren12 with stomach 36, PC6. That is going to be good for cold and damp. We can add in stomach 40 for phlegm, and then moxibustion only with spleen 4. Again, that's going to bear counterflow qi downward. With Ren 8, we are going to be boosting yang and dissipating cold. Okay, next up is Ren 13. So Shangwan upper cavity. Disorders of stomach and upper abdomen, and for disease patterns pathologically related to the stomach. So we talked about the side-by-sides before of 10 versus 12 versus 13. 13 is the upper, so treating the upper abdomen, the epigastric area. Disease patterns of the stomach, disorders of other related organs, and local disorders are all going to be used with Ren 13. This really is a great local point for all sorts of different things. More often than not, we are going to be reducing with this point. Really, this point is used to treat excess and stagnation. So that's really what we're looking at here. You may add moxa or a cooling method depending on what temperatures you've got involved, but really we're going to be reducing at this point. So differentiating Ren 13, stomach 36, both have a strong action on the stomach. Reducing method in moxa for deficiency cold in the stomach and pathogenic cold is more effective at Ren 13 than stomach 36. Stomach 36, I would argue, of all of our like go-to stomach points, is least effective at treating cold. So definitely Ren 13, Ren 12 before stomach 36. Really, with these point combinations, you're going to see here that this is kind of a branch point. So liver 3 with Ren 13 for liver stomach disharmony, stomach 36 and PC5. It's basically going to work locally for vomiting and hiccups with counterflow. With Ren 3 and spleen 9, it's going to be treating dampness and urinary issues having to do with that. With Ren 17 and UB17, a nice chi treatment, loosen the chest, benefit the diaphragm, stop hiccups in the case of counterflow. And then last one here is moxa with Ren 12, Ren 4, Ren 8. That is going to warm the yang, boost the spleen, dissipate pathogenic factors, boost spleen and also kidney yang as well in that one. Okay, next up is Ren 17. Ren 17 is a front moving pericardium. It's also the meeting point of qi. A wonderful, wonderful point. Key point for treating qi disorders, especially when the functional activities of qi in the upper jiao are affecting the heart, the lung, the chest, the hypochondrium, the diaphragm, the breasts, or the throat. So really, all of this area is going to be affected by Ren 17. Treating qi disorders of the upper jiao. Treats by freeing functional activities of qi, dissipating stagnation, and freeing the vessels. So a strong qi moving point. We can reduce or reinforce with this. I would argue more often than not, we're going to be reducing with this point to help move qi, but we can also reinforce to supplement and boost zong qi specifically. Let's look here at the bottom of the slide, differentiation of point functions. So Ren 17 versus 12 versus 6. We're looking at we're treating in different areas. We are treating different substances. So Ren 17, qi movement in the upper jiao, really, also looking at bearing counterflow downward. Whereas Ren 12 is really the middle jiao. It's going to be down-bearing and harmonizing in the middle jiao, and then Ren 6 is more specific to yuan qi. Remember, that's that source point, dissipating stagnation, but specifically in the lower jiao. So upper jiao, middle jiao, lower jiao. Ren 17, point combinations here with UB13, that's going to benefit the lung. With lung 7 or lung 5, that's going to help bear downward in the case of stuck lung qi. We can add this in with liver 14 to really help with local qi stagnation in the diaphragm and in the chest. With Ren 22, we're going to be definitely working on the upper jiao, but also on phlegm. With lung 1 and PC6, again, we're looking at the lung here, opening up the chest a little bit more since we have the front move of the lung in there. And then with PC5 and spleen 6, that's going to be moving qi and moving blood. Next is Ren 22. So Ren 22, we've been talking about this point since our first week together, right? We're looking at phlegm. We are looking at issues with the trachea, issues with the throat. So this is really a local point. It's usually a local branch point. I'm not going to go into any of this stuff because we've been talking about Ren 22 so often for so long, but let's look at some point combinations here. Again, I'm not even really going to highlight any of these because really it is going to, Ren 22 is going to be tacked on to other point combinations as a branch point. So if there is phlegm in the throat, if there is dyspnea, things like that, we are going to throw Ren 22 in the mix. Next up is Ren 23. So Ren 23 is another local point, really is more of a branch point used to treat throat disorders. So when, oh, and it's also an important point in the treatment of tongue disorders. So that separates it from Ren 22. We can actually use it to treat loss of voice or muteness when it has to do with dysfunction of the tongue muscles or of the throat or the epiglottis. Also loss of voice or speech due to cerebral diseases, heat or drug poisoning, although that's usually treated with Du Pt1. We are, more often than not, we're going to be using the reducing method on this point, but if we do have deficiency pattern, we can reinforce. So I kind of just talked about this, but a little bit more in depth with the differentiation of point functions. Ren 22 used for throat and tongue disorders, freeing and regulating the vessels of the tongue, whereas Ren 22, we can think of throat and lung issues. And then differentiation of Ren 23 and Du Pt1 because they both do treat issues with the voice, issues with muteness. Ren 23 is really about the physical aspect of the tongue, loss of speech due to tongue disorder. So what's the word I'm looking for here? Structural issues, as opposed to Du Pt1. Which benefits the brain and strengthens the voice and treats muteness and loss of speech due to brain disorders. Now we can use both for both, but Ren 23 is going to have a stronger action on that functional aspect, and Du Pt1 is going to be more of the brain aspect. I think that might be a final exam question. Thank you. All right, so point combinations here with Ren 23. I'm not going to go into any of these. You know where this is going at this point, right? We're going to slap Ren 23 on top of other point combinations when they have to do with either issues of the throat or the tongue. A couple of other Ren points that are worth mentioning. Ren 9, we know that we talked about that with Ren 3. Also has to do with water passages, can harmonize the intestines. Ren 14 is our front move of the heart. It is the #1 point for palpitations, anxiety, nervousness from blood stasis or yin deficiency. So definitely an important point. Anytime I talk about Ren 14, I always like to mention that we have to remember to needle that point safely. And then we have Ren 15, which is our the Luo point. Of the Ren channel, regulates heart, calms Shen, descends lung qi, unbinds the chest. Good for mental and emotional stress from yin deficiency. I really like to add Ren 15 into point combinations when I am treating menopausal women who are particularly like agitated or having any sort of emotional distress. I really like Ren 15 for that. Okay, clipping right along here. Things go so much faster when I'm talking into the void and I can't have conversations with you. All right, so Du channel, physiology. This is the sea of yang channels. Pathway runs through the kidney, the heart, all the way up to intersecting with the liver channel at the vertex. We know that Du channel points can be used to treat all sorts of things. Really, we're thinking about stuff along the channel pathway. So anywhere from headache and dizziness down to prolapse and hemorrhoids. This is also, there's some points on this channel for things having to do with the brain, so wind stroke, loss of speech, and then also some important points for psycho-emotional things like withdrawal, mania, and epilepsy. Those are really, the function of these points very often is related to the location. As we will see, starting with Du1. So Du1 is the low point of the Du channel. It helps dissipate retained heat, restrains the anus, opens up the Du vessel, can also treat rigidity of the spine and epilepsy. So that's what we're looking at here. You may reduce or reinforce with this point, just going to depend on what you are trying to do with it, really. But that is what we're going to see here. Issues of the spine, anal issues, those are the two biggest ones. It's a really great point for hemorrhoids and anal fissures and things like that. Next up is Du4. Oh, and I should say, students always ask me about using Du1, like do you use Du1 in your practice? And I have used Du1 before. I had a patient with perianal fistulas, which is just as pleasant as it sounds like. And when, quite frankly, when a patient has anal disorders, like if they have hemorrhoids or they have prolapse of rectum, they are going to be willing to do anything to fix it. So, and this applies to like a lot of different kinds of points. Students often ask me about points around the eyes and things like that. Points that we think of as being scary to receive, because when you all are working on each other, you don't need these points. But if you need Du1, if you have things going on like that in that area, you're going to be willing to take any needles. I did Du1, I did Du2 on this patient every single week, and he got better. So it was worth it. He kept coming back every week because he knew that it was making him better. So don't be afraid of Du1 and Ren1. I do highly recommend that you take Marie France's advanced acupuncture considerations class, because she does do practice with Du1 and Ren1. I definitely recommend trying those points while you're still in school, because I think they're valuable, and you really don't want to be doing these on a patient in your own private practice for the first time. So that's my little soapbox. Moving right along to Du4. So Du4, we are going to be looking at supplementing kidney, cultivating yuan qi. This really is a yang point as well for boosting warm and yang. Can be used to treat kidney or spleen yang. So keep that in mind. We often think of Du4 as just for the kidneys, but we can also use it for boosting the spleen. Indicated for genitourinary disorders. Also local stuff is an important point for disorders of the low back. It says here, reinforcing and moxa generally used, reduce only in true excess patterns. So that's very, very important. That's another one where you can definitely make the patient worse if you misdiagnose and mistreat. It's pretty much a reiteration there. We'll move on to some point combinations. With UB23 and kidney 3, we're really going to be working on warming the kidney yang. With UB23 and UB20, that's going to be spleen and kidney, right? Ren3, kidney 3, or UB23, that's going to be helping to boost kidney yang and help with urinary issues. With UB23 and UB25, that's going to help boost the kidney and also strengthen the low back. In the case of pain or weakness in the low back. And then last one on this slide here, we can add moxa with Ren8, Ren4, and UB23, again for kidney and spleen supplementation. Next up is Du14. Du14 we know is this intersection of all of the yang channels, so very often we are using this to treat externally contracted exterior patterns, also good for malarial disorders, any sort of issues with the Du channel, and pathological changes adjacent to the point, so almost as a local point. So point combinations here, I'm just gonna skip this slide. Point combinations with Du 14, we can combine with Lung 7, great for external invasion. These 2 points treat patterns of common cold, wheezing, and dyspnea. So we're also going to be, in addition to releasing the exterior, it's also going to be diffusing lung qi. And then we can add reducing in moxa to UV 13. That will help, of course, more with wind cold if we've got moxa. It is a nice, strong point combination, though it can also help benefit the orifices and treat phlegm. In addition, we've got with UB12 and 13, that's really going to be for wind and heat release exterior. With Li4 lung 5, we're looking at wind and heat. With Li4 and liver 3, we're looking at more internal wind. So clear heat, dispel wind, extinguish internal wind, and relieve tetany. With Si3, that's an important 2-point combination for malaria. With Sanjo 5 and GB40, that's going to be for harmonizing Xiaoyang, expelling pathogenic factors. That's a nice point combination as well. And then with kidney 7 to foster yin,